very happy to present the results of our study, which looked at antibacterial drug residues in cow milk, in chicken meat, and in chicken eggs from selected farms in several Ugandan districts. So the background to this is that there's been a concern about irrational drug use among farmers caused by their perception that veterinary services are very expensive, but also because they think that yes, that veterinary services are very expensive, and also because the prescription guidelines are not very clear to most of them. They end up getting drugs without prescriptions, and this has led to a problem where there could be concern about presence of drug residues in animal products such as milk, chicken, and chicken meat and chicken eggs. Now, the World Trade Organization, the body that regulates trade internationally, has what is called the phytosanitary and sanitary procedures. Now, these require that products, whether from the crop side or the animal side, that the residues of the chemicals we use in the production of these products are not above what is called the maximum residue limit. Now, the maximum residue limit is what is called the maximum acceptable concentration of a veterinary product within a particular food. This shouldn't be above what is called the maximum residue limit. Now, consumption of foods that are adulterated with these drugs, which stay within the animal products, could be a problem in that they may hinder international trade, and also there could be a concern as far as human health is concerned. So with that background, we went ahead to do research, and the objectives were: one, to gauge farmers' perceptions, attitudes, and practices regarding drug residues, and then secondly, to determine the most commonly used antibacterials in both cow milk and poultry establishments. And then we got samples from these outlets, especially at the farm gate. And then we analyzed for the levels of the antibacterials that we identified among. Okay, so I can shut it off. Yes. So these are objectives: document knowledge and practices, attitudes and perceptions of livestock farmers to residues, identify the most commonly used drugs within poultry and milk establishments, and then get samples, analyze for those commonly used drugs on those farms. And then finally, based on the results, we would develop manuals that could guide farmers on how to prevent the issue of residues within the animal products. So we went to a number of districts, both in central, western, and northern Uganda, to collect samples and interview the farmers. With regard to interviews, we're interviewing them about issues to do with the drugs. Where do they get the drugs? What is their thinking about withdrawal periods? Do they observe them? Can you go a little bit down? How do they dispose of the drugs? What do they think on who is responsible for ensuring that animal products are drug-free? And then finally, yes, those were the major issues. So the districts we went to for cow milk, we went to Gomba, we went to Ntoroko, we went to Chiruhura, and also went to Lamu. And And then for chickens, we went mainly to Masaka, Wakiso, to Lira, as well as to Mukono. And then after getting these samples, we analyzed them using a technique called liquid chromatography, mass tandem spectrophometry, or LCMS, which is one of the most modern techniques for determining residues of drugs in animal products. So these were our findings. Around 54% of the farmers, we are observing withdrawal periods, but a lot of them were not aware why this is important. Why is it important to observe the withdrawal periods? Yeah. A lot of farmers were not keeping records of drugs they're using in the animals and the chicken, and also the treatment outcomes. If I give the drug today, what is the outcome? Does the animal recover or doesn't it recover? Which drugs have I used? And so on and so forth. And then the other finding was a lot of the farmers thought it was not their responsibility to ensure that animal products are drug-free. They thought it is the responsibility of the drug companies, responsibilities of the veterinarians, and others. So when we did the analysis of the samples, we discovered that there are quite a number of samples that had residues of drugs. For instance, sulfadiazine, enofloxacin, doxycycline, tyrosine were detected in quite a number of chicken samples. Streptomycin and penicillin were detected in quite a number of milk samples. But the major concern was really about mainly the chicken egg samples, where at least 2 samples had tyrosine, 1 sample had sulfadiazine, and the other around 3 had enofloxacin. Now, these samples had drug residues that were above the maximum acceptable concentration. Now, that's an indication that farmers are not following good agricultural practices in terms of observing withdrawal periods. That could be the interpretation. Bigger concern was with chicken meat samples, where at least 10 of the samples we analyzed had residues of enofloxacin. Now, this is a concern because enofloxacin is one of the major, belongs to one of the major groups of antimicrobials called fluoroquinolones, which are very, very important, not only in the veterinary side, but also in the medical side. For instance, ciprofloxacin is very widely used. So if you have residues of enofloxacin in milk products and chicken products, it could trigger cross-resistance to ciprofloxacin. With milk, there are no major issues. All the samples had levels of residues below the maximum recommended, below the maximum residue limit. Now, these residue limits are usually set either nationally by agencies like, for instance, in America, it is the Food and Drug Administration, or they can be set regionally, like the European Medicines Agency sets MRLs for Europe. And in case there are no regional and national available MRLs, then they can refer to internationally set MRLs, which are usually set by the FAO and WHO Joint Committee. So the conclusion we can draw is that there is a concern about increasing levels of enofloxacin within the samples, within the chicken samples, especially chicken meat. And that therefore this calls for a review of the National Food Safety Policy and the National Food Regulatory Framework. So the nation needs to set proper guidelines governing the use of these drugs to ensure that they are within safe levels, and also set proper recommendations and guidelines for the operators in the various value chains on procedures that they need to follow to ensure that the products being sold within the country are safe from residues. In addition, we also recommended that we need to start using some rapid field diagnostic kits, which can be used to detect presence of these antibiotic residues. Some countries are already using them. Yeah, so in Uganda, we could also adopt that. And then one of our products is that we have designed manuals that could help farmers, veterinarians, and drug retailers on how to ensure that the products that are being produced are free from residues. So I wish to thank the Makerere University Reef Research and Innovations Committee and the Uganda government for providing the funding. I also thank the district veterinary officers of the study districts who were very instrumental in the conduction of the study. And then finally, my co-investigators, whom I will not mention one by one, but they're also very instrumental in the conduction of the study. Thank you very much.